Good afternoon, Mrs. Marshall.
Hello.
My name is Dr. Nidhi, and I'm one of the dentists who will be seeing you today. How can I help?
Well, I'm actually not here for myself. I'm here for my son, David. He is having some trouble with his top teeth. They are quite small in size and starting to change color, and he's quite self-conscious about them.
Okay, I'm really sorry to hear that, but I'll try my best to help you today.
Okay.
Can I ask you a few questions if you don't
Yes,
mind?
please go ahead. Yeah.
How old is David?
David is 3 years old.
Okay. And how often does he brush his teeth?
Oh God. I think he is fairly regular, but I'd say that we might even miss every day or two. I can't really say, quite randomly actually.
And do you supervise his brushing?
Sometimes yes, but David is a bit sensitive overall, so he gets very like crying and stuff like that. So
Okay.
sometimes I just leave it.
Oh, I can completely understand. It is so difficult with children sometimes. You just have to let it go.
Yeah.
Yeah. And does he use a baby toothpaste or an adult toothpaste? Any idea?
I think it's for children. Yeah, I think it's for babies. Yeah.
Okay, right. And is David medically fit and fine?
Yeah, I think other than the teeth, I think he's fine. Yeah.
Okay. Any medication he takes?
Maybe sometimes when he has the cold, he might have some cough syrup.
Okay. Is it sugar-free? Any clue?
I have no idea. No.
Okay. And does he take a bottle in the milk and sleeps with the bottle inside his mouth at night?
Yeah, well, actually, David is a really bad sleeper, so I find that if I give him the bottle before he goes to bed, it calms him down, and then sometimes he does fall asleep with the bottle as well.
Okay, right, I understand. Okay, from the information you have given, Mrs. Marshall, I can say that David is having a condition called the early childhood caries. So I'll explain you why it has happened and then we can discuss
Okay.
the management part. As you can see in the figure, his top teeth have gone all black. Unfortunately, they are decayed actually.
Oh,
I'm
that's
so sorry to tell you this, but what has happened is because David is sleeping with the bottle inside his mouth, the milk naturally has a lot of sugar, and the bugs inside our mouth, they love to feed on that sugar.
oh,
And I'm really sorry, this is really upsetting for you, but and what has happened is the acid they release has actually caused decay to the teeth.
but how come his lower teeth are fine?
Yeah, that's a very clever question. His lower teeth are fine because they're covered with the tongue all the time. That's
Oh,
why, right?
okay.
Yeah, so and this because the flow of the spit in the night reduces very much, the cleansing action also goes down, and this milk is just sitting there in the teeth, and the bugs are attacking it with the acid, and this is causing the decay.
So can it just be the milk then? Just the milk?
Milk and as you told me that he has a high sugar diet and he is not brushing properly.
Okay.
So it's sort of, multiple factors which has led to this.
Okay.
I'm so sorry, but don't worry, we can fix this.
Okay.
What I will do is first, let us discuss the management part. So unfortunately, what is gone now. And so what we can do is we can do some filling on the teeth which have become black. All right, so remove the decay and do the filling on the top. Any questions for me so far?
That sounds a bit painful. Is it going to be? Is David going to be in pain?
See, I know David is a sensitive child, so what we can do is we can make a proper plan for him and start with a very, very simple treatments, just like for today, just we can do a little checkup for him to gain his confidence, and then maybe start gradually with more complicated treatments like fillings, and everything is done under a numbing injection. So I think David should be okay.
Okay.
Right?
Okay.
And from your side, I would also like you to encourage him to come to the dentist and sort of portray a positive image, so that's boost his morale to come here to the practice.
Okay.
Make sense?
Yeah. I suppose I need to stop the milk then?
Yes.
Okay.
Your second emergency step will be to stop the milk. I know it's hard for you as a mother, but that's what we need. Because if you keep giving him milk, this decaying process will never stop. What I would suggest is gradually, sort of reduce the amount of milk, then give him water. And I'm sure he will stop the habit, because we usually suggest to drink the milk with a cup as soon as the child is for about 6 months or 7 months old, because the teeth start getting erupted that time.
Okay, that makes sense.
Yeah?
Okay. Yeah.
And also, I would recommend you to make sure he brushes his teeth twice, morning and last thing before going to bed. Because David is really small, if you could supervise his brushing, that will be brilliant. Use a fluoridated toothpaste, which is 1350 to 1500 ppm. It is available in the market. You can just turn around and read it is as good as any ingredient on the pack.
So it's not for children then? Is it for...
You can also use it. It is for the children which have got a high rate of decay in the teeth.
Okay.
So, and make sure he doesn't spit, or only spit it and doesn't rinse after the brushing. So the fluoride stays in the mouth and it makes his teeth strong.
Okay.
I hope I'm clear so far.
Yeah. All good, yeah.
And of course, lots of fruit and vegetable. Try to reduce the sugar in the diet, and make sure he brushes in the night. And even the medication which you are giving, we have sugar-free options as well.
Okay.
Yeah. So how do you know? It is written on the bottle that this is a sugar-free medication.
Okay.
So you can switch from sugar to sugar-free medications, which are of course more helpful.
Okay.
Yeah. So I know it is a lot to take for you.
Yeah.
I will give you information, the method to brush. We can also, give you a little demo how to clean his teeth better, and I'm sure he'll be fine after that.
Okay.
Yeah.
I will hope so. Thank you so much.